My name is Marissa Raymond-Flesch. I'm an assistant professor of pediatrics in the Division of Adolescent and Young Adult Health and a core faculty member in IHPS. My research focus is on the health disparities and healthcare access of young immigrants in California, particularly the Latinx community. I've been thinking a lot about health and health disparities, particularly over the last year with COVID, and even prior to that, related to health policies and policies that impact health of youth in immigrant communities. I'm really interested in thinking about the policy impacts on health of non-health focused policies. So what I mean by that is things like immigration policy that change the way that youth move through their communities, access structural supports, engage in school, engage with healthcare. And I'm really interested in the practical implications of those policies as they relate to youth mental health, access to reproductive health care, and long-term trajectories for youth in terms of school engagement, because we know that school and education are some of the largest predictors of adult health and lifespan. So I think that these things really pertain to the challenges that we are facing in the world. They are part of the larger discussion that we're having about structural racism, about privilege in the United States, about xenophobia in the United States. And I see the research that I have done so far as documenting some of the challenges that have come out of and been created by the last 4 years of really immigrant restrictive policy in the US. And I think that we can build on that work by engaging with these communities and engaging with the wonderful colleagues that I have here at IHPS and at UCSF to think with communities about solutions that take a more anti-racist approach, that are policies that not just avoid harm, but actually support immigrant communities in California and beyond to facilitate the growth and development of these youth. It's a moment of change in the United States for policy that leaves me very hopeful in thinking about what these partnerships might do to drive evidence-based policies to improve the health of immigrant communities.